The workforce is the lifeblood of every health system. It's time to take a closer look at workforce management strategies that can improve patient outcomes, employee engagement, and the bottom line. Let's start with open shift management. Meet Kathy. She's the nurse manager for a med-surg unit. A big problem keeping her up at night is staffing. She has a budget to meet and open shifts that need to be filled no matter what the cost. And it seems any decision she makes has a negative impact on the morale of her staff. No one is happy with how staffing is being done. Today, she is looking at the schedule for the next few days and sees that there are 4 open shifts. It's time to decide how those shifts will be filled. Her first phone call is to a nurse that she knows is always looking for extra shifts and is always willing to work overtime. Her next phone call is to an agency that always comes through for her. With one call, she makes arrangements to fill the other 3 open shifts. While using overtime and contingent labor resources, Kathy gets the open shifts filled. But those decisions come at a price that's too high for her budget. She needs to find a better way to fill the open shifts. The key is using her staffing and scheduling technology to turn workforce data into better outcomes. First, Kathy can attach non-monetary rewards or points to one of the open shifts. Shortly after it's posted, one of her staff nurses picks it up and she's eliminated the need for one agency nurse. Next, she uses her staffing and scheduling solution to find a PRN nurse who is not working up to her committed hours, and she adds her to the schedule. Another shift filled without the need for a costly agency nurse, and Kathy's savings have grown to over $400. Instead of calling in the nurse that always likes to work overtime, Kathy posts the open shift and a qualified nurse from a sister facility across town picks it up. That nurse was called off earlier in the week because of low census in her home unit, and she was looking for an extra shift. Kathy still has 1 shift left to fill, and she puts a request in to her internal resource pool. A qualified nurse is available and the last shift is filled. By using the data to make better staffing decisions, Kathy was able to save over $800 with just a few small adjustments. If those small changes are made every single day, on every single shift, there's a huge impact on the bottom line annually. If Kathy makes just 1 cost-saving adjustment on each shift, her unit can save the organization almost $175,000 each year. If every unit makes those small adjustments, the organization can realize labor cost savings in the millions. This is a story with a happy ending. These days, Kathy is sleeping better at night. Her unit's labor costs are better contained, and her staff is more engaged in the staffing process, which has boosted satisfaction. Kathy has successfully turned workforce data into better outcomes.